Mesha, good afternoon and welcome to Safaricom House and Michael Joseph Center.
Thank you very much, Sanda, and very, very good to meet you today. Thank you for finding time to have this very important conversation with us. So maybe to start us, so what I would like to highlight is that traditionally, we are an NGO.
Yes.
And what is happening is, as an NGO, we have relied on traditional donors. But that's changing. Kenya being a lower middle income state, the funding from traditional donors is going down. And the question is, what next for us? Is this something that Safaricom is conscious of? Yeah.
So, it's very interesting when we read that our categorization had fallen into lower middle income because, whereas I appreciate that from a macroeconomic perspective, the fact of the matter is, and I'm sure Amref will speak to this a lot better than we can, is that things are still the same on the ground. Our maternal mortality rates, yes, they have improved, but they're still, I presume, in the high 300s in some instances and a lot lower in other places. If you look at economic growth, we're still here debating about GDP-led growth versus inclusive growth. If you can look at literacy rates, they've changed, but it's not a significant change. So I think for me, and the way that we've approached it is we understand from a macro perspective, we may be lower middle income, but the truth is that I think a lot of the social development indicators remain the same. And I think an analysis that I really appreciate is the World Bank and the way that they've gone now into looking more at social development indicators and not necessarily always infrastructure-led macro development indicators. So we still remain true to asking the question, what are the real day-to-day wananchi problems? And I think because of that, organizations such as yourselves will always remain relevant. I think for me, the key issue is continuing to build a strong advocacy case for it, because I think many of our key donors still appreciate that the fundamentals on the ground are still the same. And, none of them have drastically pulled out already. Perhaps they're just taking more gradual approaches to how they shift their funding. So I'd like to say, whereas on the macro level, it looks like we're progressing, I really don't believe that at the community or household level we are. And we still remain very much a lower income country. And also the disparities remain. The maternal health conditions in northern Kenya are very different from here in Westlands and other places. So I think we can always continue to trade on the diversity within our socioeconomic fabric and see how that plays out to different donors and different donor interests. So, to us, we still remain where we are. The numbers don't lie.
Well, it's very important you highlight the whole issue of disparities, inequalities, and potential role of organizations like yours and ours in terms of advocacy. Of course, that means that as we move forward, we need to continue focusing on the populations that still remain disadvantaged despite this economic growth that, according to the numbers, has happened. We still remain a country of inequalities, and I think we really need to continue addressing that. But tell me, Safaricom and M-Pesa Foundation, how are you responding to this shift in the development financing landscape?
So, we're not, in the grand scheme of things, I think our foundations are not necessarily very large funders. We're certainly not at the same level as your USAIDs or your DFIDs, in the country, but certainly perhaps amongst corporate foundations, we may be one, some of the larger ones. But our take, I think, on development as a whole has been shaped by two things. First is the advent of the Sustainable Development Goals in 2016. And there was a very strong call for private sector to really get engaged in social development issues. But the call here is not so much from a philanthropic perspective, but more about how you can bring your corporate assets to bear. So it's your products and services, your innovations, your technologies, etc. So that, I think, has perhaps helped in shaping a little bit more of corporate thinking around the role of the corporate in driving social impact. Now, that may not necessarily result in cash-based funding, but it can certainly result in more innovative partnership models that aim to drive things a lot further. I think also one of the biggest challenges we will face as development actors and people like yourselves that respond on the ground is that I think the brick and mortar approach of of delivering development really can't work anymore. It's far too costly, and it's not really effective and efficient anymore. So whereas in the past we could have said, as we actually did with in our partnership with the M-Pesa Foundation, let's go around and rehabilitate 50 plus clinics in Samburu County. I think it's been impactful, but it's taken us 3+ years. Would we do it the same way, with the same amount of resources and the same efficiencies? I'm not sure that we'd simply replicate that model. I think the questions one would ask now is, what products and services can we bring to bear? How can we integrate technology more into what we're doing and deliver services more effectively? So I think for us, one, we started looking more at how can we also deliver products and services that can drive healthcare, education, agriculture, and also deliver on the sustainable development goals. But the second for us has just been remaining true to what we know the needs are within Kenya. We've also shifted our thinking a little bit more to go more into proactive funding and partnerships. So previously our two foundations, about 99% of what we funded was based on proposals we received, and which is what a typical corporate foundation will do. The challenge with that is you're never in charge of your results, and also you miss out on great partnership opportunities, and that has really shaped some of the discussions. Actually, we're really grateful to have Amref come and participate in the strategic planning for Safaricom Foundation, also shape some of those partnership discussions.
Related to a concept that I've learned actually from Safaricom called shared value, or corporate shared value. What is shared value from your perspective and the perspective of the Safaricom and your foundations?
Two Harvard professors, Michael Porter and Mark Kramer, actually came up with this concept about 10 years ago now. And it was really about looking at how when people get together, what they create is shared or constructive value. Sometimes the terminology shared might mean that the value is diminished as it's shared, but it's really about taking 1 + 1 and ending up with 3.
Right.
And it taps into also the ethos that the business of a business is no longer purely business. So businesses will not survive if society around them is failing. And then therefore, what is the call to businesses to get engaged in social impact? And that's really what shared value is about. It's also about addressing the fact that perhaps, businesses and organizations around the world continue to focus on serving the very wealthy, the 1%, whereas there's massive opportunity in serving the 99%, the underserved. But the shared value concept then lays out exactly what you need to do to deliver that constructive value for the masses. And that's a couple of things. The first is reconceiving your products and services. And that's from a corporate perspective, and I'll give an example. The second is really looking at your supply chain and how you make your supply chain more robust and inclusive. And the third is just recreating your entire ecosystem around you. So the shared value concept really starts with a business or a corporation in the center, but it aims to first address the masses by delivering an essential social good. It also aims to address a supply chain. It also addresses the overall ecosystem. So, then one may ask, so where are the opportunities for entities such as yourselves? And I think one of the things that Amref really brings to the table is, first of all, you have excellent connections to the community in, wherever you've done your programming in, be it maternal health, NCDs, the others that you work in around health system strengthening. You have that understanding of what social impact is and what the social needs are. And that is a very valuable part of the overall shared value chain. In other words, you are with the people and you have the insights. And I think organizations such as yourself can now flip the discussion into, how do you advise corporates on how they can deliver on social impact? Because I also find actually that a lot of corporates, especially at this time of the year, are looking for, we have some extra money, what can we do? There's a couple of strategic changes that need to happen. First, I don't think people should only give because it's Christmas or because it's profitable, but how do you weave that partnership into what you want to do as a corporate, and what are the things that you are interested in? So, you have a great evidence base around maternal health, what the needs are, both from a service delivery, a quality assurance, and a health system perspective. Maybe those are the kind of things that you can go to a corporate and say, well, listen, I know that you work in technology. I think one of the key gaps in health systems right now is X. How can we work together such that your product can help deliver value to the people in this county, and count that as part of your social impact work? what has been shown in countries like India is servicing that 99%, even at a lower cost, will still deliver business value for you because of the sheer volume of the amount of people with whom you're working. So it's a very much social impact, social enterprise led model, but what it often requires is a partner such as yourself to identify what those social impact opportunities are. The way that it's played out in Safaricom is, we've worked in Leap was obviously one of the early starters that we had that is now commercial with yourself. As you know, we've worked with CarePay and Farm Access on MTBA, which is another one. We're now exploring opportunities in agriculture with NGOs, governments, etc., to deliver value to the smallholder farmer, and looking at a couple of opportunities in education. But all of those actually ultimately deliver social impact. They deliver to a developmental need, and they allow the corporation to keep in some semblance of business sustainability or profitability in some instances.
Wow, amazing. Focusing on the 99%, not just the 1%.
Not just the 1%, yes.
And building on our evidence base. I think that's very, very important. Thinking high volume, low cost.
Yes, absolutely.
For the masses, I think that's a very, very important point you make. And very relevant to us, even as we think of new solutions like crowd prevention, wellness, and all that, which have not been very, very easy to invest in.
Very true.
Yeah. So the question is, what opportunities in the Africa or Kenya space for that Amref could leverage, given our brand and all that?
Let me first tackle the bit on individual giving or high net worth in giving. I think there's a great opportunity. There's two structural issues that we'd have to address, and one that actually I would love to partner with Amref on, which is actually really to address the tax regime around individual giving and high net worth giving, because it's not the same as in the US where you get a tax deduction because you've given, etc. If we could figure out a way to work on that, I think that's a very long-term solution. But in the short term, again, and it points to a comparative advantage that you have. Kenyans give for what are termed emergencies. Yes. Now, an emergency is currently like what's going on right now. I think we read that 132 people have died in the recent landslides. There's 10 high-risk counties. But however, as you and I know, 20 mothers die every day in pregnancy and childbirth. Why that is not emergency has always been a mystery to me. So, I think one of the things that we need to do is really shift what the definition of emergency is and what people need to give to. So the challenge is upon yourselves, I think, to again take your evidence base and your advocacy work and turn it into something that will be front and center of a national narrative. I know that our First Lady did a great job with Beyond Zero around raising the challenges and opportunities around maternal health, but that has its ebbs and flows. Incidentally, she's just launching the next phase today. But how do we create a cohort of media interest people, companies who will continuously talk about the importance of supporting maternal health initiatives, and then therefore create the opportunity for continuous giving? I believe the goodwill exists. I just think the challenge is the way that we have, or the way that media has shaped the narrative is one that's only driven to, I'll call it humanitarian emergencies. But there's a great opportunity around it. I think there is. For Kenyans to learn how to give differently. Because they've demonstrated when they do give, they can give. Yes. On that. I think that the shift in the donor funding base is an interesting challenge for yourselves on that. As we had just talked about earlier, the shift from aid to more trade-related type issues. I see two possible solutions to that. I think one is, yes, obviously diversification is going to be critical. We'd spoken about exploring some of the non-traditional donors and going to different areas of soliciting funding. And I do really think within Kenya, there is a lot more opportunity to deepen your private sector engagement. I see government doing it a lot. I see UN agencies doing it a lot. I think there's a really good opportunity around private sector engagement. A lot more corporates are putting aside money to deliver on social impact, but they actually don't know how.
Are there other areas, are there other things that you sense an NGO like ours needs to be doing in order for us to be uniquely positioned to work with the private sector, corporations, foundations. Yeah.
So I think, again, drawing from something that we've done, and I'll go back to LEAP, which was the platform that we developed.
Right.
I do think that, looking at solutions like that tap into what an private sector organization's core strength, the core capability is, and flipping that into a social enterprise tool is a fantastic opportunity within other corporates, even with Viacom itself, and looking at how you could deepen and further tools like that. Okay. I think the idea, as I mentioned earlier, the brick and mortar approach to healthcare will not work anymore. So how do we build in all these other efficiencies that one could drive? Right. I also think that some of the really great opportunities now rest in not so much yourselves going out, sending proposals. It's about yourselves having conversations with organizations about, what is the health situation? Where do you see the opportunity? So, whereas before we'd have conversations about, here's a traditional funder, how do we match their funding needs? I think you need to have the conversation around, this is a corporate, how do we address their need to engage with society or deliver societal impact? And I really do think that corporates around, at least in the country, are really, there's a strong desire to have that conversation through forums, through workshops. So, even the inquiries we get here in the business, I do think that corporates want to act and partner differently.
Corporates want to act and partner differently. And I fully hear you when you talk about having conversations. It's conversations that drive the world. So I think that's a challenge to NGOs like ours. We need to deepen conversations with foundations like yours and others on core issues affecting the 99% of the people. Absolutely. And we make sure we are putting evidence on the table. I think that's transformational thinking. Earlier on, you talked about individual giving and how it works for the humanitarian sector. Yes. Because obviously there's a lot of emotion around that, rightly so. And you highlighted that we need to sort of flip the coin and work with media partners to create a different narrative that we build into the psyche of the people of Africa and Kenya about even giving for development.
Absolutely.
Mothers are dying daily because of complications. And I'm happy you say that that's an area you'd want to partner with us. Could you deepen that a little bit, in addition to the tax regime and working with media partners? It has not been an easy nut to crack.
I think for me it's because the challenge with development work and media focus and how Kenyans consume media is nobody really wants to go the long haul. Our news cycle, 24 hours, everything changes. Yes. But, my question is, how do we take the story of this lady who will today have a prolonged delivery, have a difficult pregnancy. Yes, she may have her child born healthy, but will end up with fistula at the end of it. How do we take that narrative and perhaps translate it into something that is a very clear 2 to 3 minute story with a very clear call to action? How do we also get more of the media to see the success stories at the end? We call it in the shared value speak, actually, and this is something that Mark Kramer, one of the authors, was trying to work with one of the media houses around. It's called solutions journalism. So you don't leave a story hanging. So you don't do your expose and leave it hanging. What are really the solutions? Yes. So how do yourselves then perhaps sit with media houses and say, look, we want to take a different approach where we're actually looking at providing solutions and then providing a platform for Kenyans and other people to get involved in and be able to do it on the long term. And I know of one media house that is really trying to explore that a lot more as a differentiator, because you can't just have exposés every week and leave people hanging. As you know now, we're not eating meat, we're not drinking milk, we're not, that kind of thing. But how do we but how do we create a story that end to end has a solution? I think the big challenge we face is we've now been trained to consume media in bites, but within those bites, the 2 minutes or so, how can we successfully communicate that and communicate it in a way that makes sense and show what the solution can possibly be?
I think as we have gone through this conversation, 2 things we have talked about is shared value and also social entrepreneurship. Yes. And you have also highlighted the whole need, the issue around advocacy and how our advocacy efforts should be focusing on the 99% and all that. I would want you to speak on each of this briefly. Maybe we can start with the issue around advocacy. So looking at the changing landscape and where Kenya is, we are as a country, the needs of the 99%, and obviously looking at the global scene, the SDG framework and all that. What do you see as the sweet spot for Amref and advocacy work? Where should we be putting our effort on?
I think there's a couple of areas to focus on in advocacy.
Yeah.
Where you already have a strong evidence base, I would definitely not let go. So I think your work in maternal and child health is good, and it also latches onto a number of key things in our national narrative, that have been ongoing. So I wouldn't lose that. I think, to be able to capture an audience that will probably tie you back to individual giving and that sort of thing is, I'd like to propose that perhaps expand the conversation, not only on disease but also on wellness, and then show the wellness related outcomes and what happens, so that you can look at what happens along the entire continuum of healthcare.
Yes.
Because I think often we focus on the problem and the solution, but not what happens in the wellness state. And I think a lot of organizations want to invest in just being well. So how do you support mothers to make sure that they do their 4 visits? And not so much how do we support mothers when there's complications and fistula and the other adverse outcomes and that sort of thing. So just shifting a conversation where you can perhaps address everything along the core platform perhaps might be one way to look at it, I think. The other thing for me and my challenge to Amref would be that there are lots of actors in the area. What would you say is the 1 or 2 things that you would stand out for and sort of drive that as your core advocacy message? Because at the end of the day, it's about how you build your unique proposition, what you are known for, what you are good at, and what people would want to support you for as a whole.
Great. Many actors, so we have to find our unique spot. Yeah. And I'm sure we'll be having that conversation. But I'm happy you also mentioned the issue of wellness, because this is really emerging as a big area for us, because it's a new conversation we need in our psyche as the people of Kenya, talking about being well and not waiting to be sick.
And not waiting for...
Yeah. In case you'd want to comment on wellness within the context of non-communicable diseases, feel free to comment about that. I'll be very happy.
When we shift the conversation to, people give to things that are familiar to them or that they relate to. And I think NCDs has often been described as, that silent killer, etc. What is interesting about NCDs actually is that it obviously has no socioeconomic status, no age limits, etc. So I think people can really relate to NCDs, be it diabetes, hypertension, cancer, whichever angle you want to take. And I think on that, wellness really plays a key role. And I do think it's also an area where you can tap into the psyche of individual givers, of corporates. I mean, I know an entity who, for example, approached us, and it was around gender-based violence, and said, how can we work with you both to conduct an information and wellness clinic for your staff, run it through your overall wellness portfolio, etc. And that became a consultancy agreement, And if you could imagine taking something that is of, your core strength, maybe it could be talking about diabetes and hypertension, and working through a number of organizations to just talk about what you do with your staff, how do you integrate wellness into what you do, turn it into another income generating opportunity for yourselves. But do that on scale with 10, 15 corporates, get them to also see the importance of supporting people within their communities who might not have the same privileged access as they have by virtue of working in a corporate. You can actually build up a whole business cycle around it. You're getting consultancy fees from a corporate, you're mobilizing individual givers while you're at it, and then you have an overall type response over there. But I think your point is very important. People give to things that are near and close to them.
Close to them.
And I think the issues around diabetes, hypertension, cancer are all very topical right now.
Yes, things that are near and close to them. If it's not myself, yourself, say your parents, your grandparents, or your children have non-communicable diseases. So very, very, very understandable. I also like the way you link advocacy and giving, and individual giving, because I think there's something we have really not thought about, how we think about our advocacy campaigns and how we are linking them to how people give and what people give. So that's something transformation also for us. I like also the way you challenge us, get 10-15 corporates and they're all giving their consulting for wellness and whatever.
Absolutely.
That's shared value, and I think there's a challenge. Where do you see beacons of hope in terms of organizations, corporates that we could benchmark with in terms of social entrepreneurship, of course within the Africa context?
I actually think the opportunity for social entrepreneurship probably does not lie with an organization like ourselves.
Right.
Because shifting the thinking between, we're here, there's opportunities, but we want to take some time to tinkle and innovate a little bit, etc., is a culture that we're growing, and I think we're doing well at it. But I found a lot more flexibility in medium and small enterprises where you have a really big push on social impact innovation and entrepreneurship, and that are perhaps probably more risk takers around it, because I think and there's a wise man who once said this: the opportunity that lies within working in the development space in Kenya is there's a lot of challenges, which means there will always be a lot of opportunity to solve them. So we're not short on context. I think the issue is just continuing to develop solutions that make sense. What often happens in social entrepreneurship is people sort of develop the solution before they have a full understanding of the problem. Now, if you have investment that is patient enough to allow you to really deepen your understanding of the problem and then develop the relevant solution, and then the patient capital to allow it to pilot, test case, and then scale, I think those things work really well. They're far and few between, but the reason why I think we've had great successes on things such as LEAP and on MTIBA and a couple of things we're trialing within our organization is allowing having enough investment capital that is patient. So I think you need to find the right partners for that, who are willing to take 18 months, 24 months to try out an idea, make sure it works, bring in the right people around the table, and go forward on it. And again, I think you're very well positioned because you are the people with the knowledge of what goes on the ground and perhaps how to build the right ecosystem around it. Again, great opportunities, I think, for organizations who are willing to create that space for an 18-24 month incubation. What often happens, which is what we must continuously avoid, is hey, I think there's a problem with maternal health on the ground. Hey, here's a very quick solution. Let's put it together. It becomes transactional, and then the product is left hanging. But I think a lot more co-creation, getting the right kind of investment capital, and being very clear on what the problem is that you're trying to solve, I think leads to lots of success.
Amazing. Co-creation, patient investment capital to allow enough time to tinker and iterate on the solution, and really making sure that it's responding to the needs of the targeted consumers. I think that's really transformational.
And if I start that, I think there's a few progressive foundations, barring our tax regime that is a little bit problematic, who are now willing to put money into that kind of investment. So rather than go in for simple, grant funding for programmatic interventions, it's more about how can we leverage the funding that we have to deliver, solutions that are more sustainable and long-term as you go forward. So you could possibly deliver the same impact, address the same problem and challenge, but from a very different approach.
You want to give us a few examples?
I will still first go back to LEAP because I think actually for the M-Pesa Foundation, that was one of the very first different type of interventions that we did. It then led on to MTIBA. It then led on to conversations within our business, and I mean the business angle, the business part of Safaricom, around how do we invest in platforms that deliver social impact. And those products, and Paul will share with you when you meet with him, we're not pushing for P&L results in this year. We're working on an agriculture platform that we have realized will deliver impact in a few years to come. But the thing is getting the understanding within the business that if we want to impact the way smallholder agriculture is run, it's not going to be something that you'll book your revenue in a year.
Absolutely.
But the impact over time will be immense. And, from a corporate perspective, these guys will be your customers for a long while because you've addressed them at their most fundamental need. So it could be a discussion you have with an insurance company, a discussion you have with, a company that does messaging, anything that works within your, your health ecosystem as a whole.
And again, that is the whole concept of shared value, of getting all these people in the ecosystem to address needs, iterate, co-create, ensure we have evidence. And
an example that comes to mind, and I think it might be Philips, that developed this handheld ultrasound machine.
Yes.
And has been wildly successful, I believe, in India or elsewhere. And just in terms of, instead of delivering the large machine that you station in your hospital, what do you do for that 99%? How do you price it right? How do you train the community workers? And then how do you feed those results into a growing and robust health system?
What is your message to our board of directors as we really sort of look forward and look out into building the Amref that will be serving the people of Kenya 20 years from today?
Well, first, apologies. I would have loved to have been with you in Malindi, but I will be in Kigali. I think the board has a great opportunity to really shape Amref's positioning and what it stands for. And as the board continues to steward and lead Amref forward, how do we develop that unique proposition? What does Amref stand for? What do you do? And this could be also how you differentiate yourself operationally. How robust are your systems? How efficient is your reporting? How are your relations? How do you manage your donor relations? How do you cultivate your partners? But for me, most importantly, is what is the singular advocacy message that Amref wants to deliver? As I start off by saying, I think people give to people. And if we can identify what that key issue is for Kenya, that we think will tap into the individual, the corporate, and the large donor funder, I think you will deliver continued success. I do know that there's organizations that work on multiple advocacy messages. I'm not sure that is very successful. I think there's the opportunity to really look at what your core strengths are and develop a very powerful advocacy message around that, and then look at continued different types of partnerships, as we've talked about, more corporate sector partnerships, and really leveraging more on the concept of shared value.
Thank you. People give to people. What is the issue that the 99% of the people in Kenya will connect with?
Absolutely.
Once again, thank you so much.
Thank you.
Very, very helpful. We're looking forward to an exciting conversation and a great future for Amref. And we also wish Safaricom very well, the best of wishes as you look into the future.
Thank you.
Always bringing amazing innovations to the market and really transformational work you have done and pioneered in the shared value space.